Days after schools have reopened, some students have landed back at home again, forced to isolate or quarantine because of COVID.
Labor Day Monday, my son had symptoms and tested positive on Tuesday. Who's 11 years old, who's unvaccinated, who was wearing a K95, N95, and a surgical over it to school.
Donica Petrosius says the only time her son had his mask off was at lunch and when he was part of a random sample of COVID testing. Donica's friend, who also has a child who caught COVID at a DCPS school, joined her in writing a letter to city officials urging them to improve safety and virtual learning options.
I'm so frustrated because it's the lack of notification, the lack of information from the school.
There has to be better transparency and communications, and they have to work faster. We need more testing.
The deputy mayor of education and DCPS sent us statements essentially saying they're working to implement the best safety policies and inform families quickly. Now, some of those kids sent home are rushing to hospitals like Children's National, which said it had to go to surge capacity recently.
We're seeing an increased number of patients who require hospitalization. There seem to be two main factors involved here. One is an early and large peak in what we would usually see as a winter respiratory viral illness pattern. We're also seeing more COVID patients.
While University of Maryland Capital Region Health says their ER hasn't yet seen too much of an uptick, their chief medical officer urges adults to do their part to protect kids.
Vaccinated adults in families will prevent transmission to unvaccinated children.
Now, Dr. Wright expects cases and hospitalizations to surge in a few weeks because of the reopening of schools and the Labor Day holiday. Now, there was also so much more to that letter than I was able to share, so I'll make sure to post a link to it in this story online. Annie?